We are back with Dr. Ali Hassoun, infectious disease specialist at Huntsville Hospital.
Dr. Hassoun, we want to talk a little bit about the coronavirus outbreak we saw in our nation's capital. We found out a couple of weeks ago that the president, of course, and First Lady tested positive. Their son, Barron, he's 14, tested positive several days later. All three have tested negative. We want to ask, can you explain the situations that households face when one member of the family tests positive, and how long people should be worried about spreading it after that happens?
So in general, patients who get infected will be infectious for about 7 to 8 days after the symptoms started. But if you have severe infection, you can be infectious about 2 weeks or more. So it depends on did you develop pneumonia, did you get admitted to the hospital, or were you at home, had fever and sore throat only versus major pneumonia and needing oxygen. So each stage can be different, a little bit infectiousness, but usually 7 to 8 days, and it can get prolonged if you're much sicker. People need to, if they had one member infected, they're going to need to quarantine and separate themselves. Watch for symptoms. They can always get tested about 7 days later if they don't develop any symptom to make sure they stay negative, or quarantine for 10 to 14 days from their last exposure. And if they don't develop any issues, usually it's going to be okay.
First Lady Melania Trump said that her son Barron was asymptomatic. The president said his son, like many other children, are able to fight the virus off better than adults because of their immune system. And this has really been a major factor in getting students back in the classroom. So from your perspective, what have you seen when it comes to the virus's impact on children? And what do we know now about why they seem to be able to fight it off at a higher rate?
So we need to divide the age group of children between below 8 or 10-year-old and above 10-year-old, because we've seen those below 8-year-old, probably they will have less transmission to others. They can get infected, but usually very mild or minimal symptoms. Those above 10-year-old, actually they get infected as much as adults, and that's the group where they can transmit it to adults. And in the school, of course, teachers, at home to their grandparents and parents. Symptom-wise, again, can be mild, but I can tell you we've seen 14, 15-year-old can get really sick with it. And some of them can have some effect on their heart, some effect on the brain. It's not as common as what adults get, but it's still possible.
Today we learned someone who flew with presidential nominee Joe Biden this week tested positive for coronavirus. We also know Senator Kamala Harris suspended campaign stops until Monday. That came after one of her staffers and a flight crew members tested positive. We are seeing President Trump hold rallies now where there are some masks but no social distancing. We've seen that for months at protests around the country. As a medical expert, what are your thoughts and concerns when you see these types of events?
It is very concerning, definitely. You know, this is a setup. Everywhere where there's a crowding and there is a close contact with no masking and no precautions, it is definitely a setup for significant transmission, because these people is going to stay there between close to each other for a long time. It's not going to be a minute or 5 minutes. It's going to be hours, and that's when the virus easily can transmit from one person to another. And that's a big setup for increasing cases, more transmission, and it is basically setting up for significant problem as a community and healthcare facilities as well.
Dr. Hassoun, right now people across North Alabama are really concerned about the future, and rightfully so. We are seeing an increase in cases across the U.S. and there's still no vaccine. We obviously don't want there to be any more cases in North Alabama, but from what we've seen in the region, we can expect cases to continue to go up at this point. So what is your perspective on where we are as a region and the numbers? Are they too high?
At the moment, I must say, they are not too high. They're actually as expected in a level. But what we're seeing, probably we're going to see significant increase with time. And that's why we need the community and everybody help us with the prevention. Because if they do the physical distancing and masking and hand hygiene, avoiding the crowd and the close contact, we're going to be able to control things and do much better than expected, where cases might go up significantly. And at least give us time to get to the vaccine or get ways of treatment that's more effective than what we have. And hopefully we can control the virus better.
You and other healthcare workers are obviously dealing with a lot right now. Our hats are off to all of you. But how are you and the rest of the staff dealing with the difficult situations you find yourselves in?
I can tell you the months of June and July and early August was very, very stressful, was very hard and challenging, because we want to help all our patients, we want to take care of them, but it was very difficult. Late August and September was much, much better in the way of the viral transmission, and the numbers went down. But we feeling it's gonna come back. We are ready to try to help, but we need the community to help us still, so we can control things and help everybody rather than certain set of population.
Dr. Ali Hassoun, infectious disease specialist at Huntsville Hospital.
Dr. Hassoun, thank you so very much for your time and insight tonight.
Thank you so much.